The MSU Texas community is watching the university's response to coronavirus as infections reach record numbers since the shutdown. Wichita County has just survived one of its deadliest weeks of the pandemic. With more than 1,700 active cases and 93 deaths since COVID hit, the MSU community is wide-eyed as the university takes its next steps to slow down the spread of coronavirus across campus. Provost and Vice President for Academic Affairs, Dr. James Johnston, says that though the virus is constantly changing, the university continues to rely heavily on the basic protocols to reduce the spread.
The virus changes too, so we always have to be mindful that you're dealing with a moving target. But what we ended up relying on is to wear the face mask, to maintain your distance, and to wash your hands.
Since the summer, the university has implemented an incident management team to discuss and review the rapidly evolving virus to make it possible for students and faculty to learn and work in a safe environment. Since July 1st, MSU has reported a total of 212 people who have been infected by the virus. The incident management team and the Vincent Health Center work close together to test as many students as possible, with testing up to about 20 to 30 students a week. MSU hopes to promote an environment that is well equipped for the fight against coronavirus. Medical Director of the Vincent Health Center, Dr. Keith Williamson, says the lack of testing on campus makes it hard to track the results.
I would certainly like to be doing more of the students' testing here on campus because they go all over the place to urgent care centers and drive-through places, and it makes the results hard to track. The more we do here, the happier I am.
Every policy has its limitations. Policies like self-reporting, social distancing, and facial coverings can't be enforced by the university. A system that relies so heavily on individual cooperation leaves room for inconsistencies and unsafe environments. According to a small poll on Twitter, 72% of students on campus feel unsafe. COVID-19 survivor Omar Combi says that although he feels it's best for the in-person classes to come to a halt, he believes the university is taking good practical steps, forcing students to be more accountable in slowing down the spread of COVID.
I will admit they are doing a decent job considering that Wichita is basically on fire with COVID and the school has remained relatively low in terms of confirmed cases. So they are doing good practical steps, and at the end of the day, it really is up to the students on whether they want to follow them.
Though cases are still on the rise across Wichita County and in the MSU community, MSU has taken some strides to protect further infection, like canceling spring break and slowly developing new information to increase transparency on the COVID-19 dashboard. A virus that changed lives 8 months ago still has so many unknowns that MSU officials are working hard to understand. For M&G Media, I'm Kirstia Sheffield.